My name is Burcu Onay, and I'm representing Effective Pharmacists Society in Turkey. I would like to mention about our breast milk project titled as Your Baby's Health is in Your Breast Milk. Effective Pharmacists Society was established to develop good pharmacy practices that protect public health in pharmacies and to support the implementation of projects to harmonize the basic principles of the pharmacy profession with primary healthcare standards. Today, the society has 400 pharmacist members from all over the country. United Nations 24th article of the Convention on the Rights of the Child includes the obligation of protection and support of breastfeeding. Every infant has right to good nutrition according to the Convention of the Rights of the Child. As global crises continue to threaten the health and the nutrition of millions of babies and children, today protecting, promoting and supporting breastfeeding is more important than ever, not just as it improves nutrition, ensures food security and reduces inequalities between countries, but also for the survival, growth and development of millions of infants. Breastfeeding is the best possible start in life for a baby and also acts as a baby's first vaccine, protecting them from common childhood illnesses. UNICEF and WHO recommend that mothers start breastfeeding within the first hour after birth, and they should exclusively breastfeed their babies during the first 6 months of their lives, meaning no other foods or liquids are provided, including water. Breast milk makes the world healthier, smarter, and more equal. The deaths of 823,000 children and 20,000 mothers each year could be avoided through universal breastfeeding. Breastfeeding has been associated with fewer infections, increased intelligence, possible protection against overweight and diabetes, and cancer prevention for mothers. Breastfeeding is associated with the United Nations Sustainable Development Goals for 2030, like promoting a healthy and quality life for all ages, and hunger, ensure food security, to provide equitable and quality education, to create lifelong learning opportunities for all. In 2012, the World Health Organization endorsed a comprehensive implementation plan on maternal, infant, and young child nutrition, which specified a set of 6 global nutrition targets that by 2025. Target 5 is determined as increase the rate of exclusive breastfeeding in the first 6 months up to at least 50%. The evidence that breastfeeding benefits women, children, as well as communities and societies has never been stronger, but breastfeeding rates have remained stagnant for the last 20 years. Too many children are missing out on this tremendous boost to their health and well-being. Too many women are not receiving the information and support they need to breastfeed successfully. Globally, only 44% of infants are exclusively breastfed in the first 6 months of life. In Turkey, 41% of infants under age 6 months are exclusively breastfed, and the median duration of exclusive breastfeeding is 1.8 months. The proportion of exclusively breastfed children declines rapidly with age, and it decreases to 14% in 4 or 5 months. This year, the theme of World Breastfeeding Week is Step Up for Breastfeeding, Educate and Support. UNICEF and WHO are calling on governments, donors, civil society, and the private sector to step up efforts to equip health and nutrition workers in facilities and communities with the skills they need to provide quality counseling and practical support to mothers to successfully breastfeed. Pharmacists are often the most accessible medication experts, and they are reliable resources to provide information for the responsible use of medicines during pregnancy and breastfeeding. Pharmacists are in an ideal position to conduct a risk assessment and make evidence-based recommendations if a mother wishes to continue breastfeeding while taking medication. With their highly visible roles in the community, they are often asked for breastfeeding-related advice and have interactions with women that makes them a key component in breastfeeding promotion and support. As Effective Pharmacists Society, we have implemented the Breast Milk Project in order to support the increase in breastfeeding rates in our country in line with the target of the World Health Organization. As we have started the Breast Milk Project, we first formed a scientific advisory board, including 1 public health professor and 9 pediatric professors. We have planned an education series about the importance of breastfeeding, breastfeeding problems, and responsible use of medicines during lactation. After we made an intensive scan on articles of clinical studies, we prepared a brochure to inform and support women during pregnancy and breastfeeding. We enabled women to access all information for their special needs during pregnancy and breastfeeding from the Society website by scanning the QR codes on the brochures and the cards in our pharmacies. As Effective Pharmacists Society, we have a health magazine published every 2 months since 2012. It has been a year we have started to post articles about breast milk and breastfeeding in the magazine. We have been using the social media channels of our society to inform the public about this project. We are excited to have positive and pleasant reactions from the public and the health professionals. We hope that as this project continues, we will be able to reach and empower more women for their own and baby's health. At the point that we arrived in short-term study, we have realized that in primary healthcare, pharmacist consultancy in breastfeeding is very important and convenient. We have started this project to be published as an article in related medical journals. We would like to generalize this consultancy service in primary healthcare by collaborating with other health authorities to improve health outcomes in both maternal, child, and women health. We are planning to collaborate with universities in order to emphasize the significance of breastfeeding by young generation. We intend to have private areas in our pharmacies for mothers to breastfeed. We are planning to support breastfeeding policies structured by FIP, WHO, and UNICEF and improve the pharmacist's role in maternal, newborn, and child health. We believe that breast milk can be a part of every child's healthy start in life. Make our planet healthier, more equitable, and sustainable for future generations.